I'm sure I'm not the first person to say that I wish I had edited that and said no expertise, because there's nothing like speaking to a room full of PhDs and EEDs and have someone to say you're an expert. So let's get that disclaimer out front right away, okay? So I'm not an expert. But I'm very happy to be here talking with you today, because partnership and its accompanying capacity strengthening is really the heart of CRS's work overseas, and it's the heart of who we are as an institution. And I bet the IHD people said that to you too, but no, it's partnership. So, you know, CRS has been working with local institutions for its entire 70-some-odd year history. And how we've done that has certainly changed over time. And it's changed as the nature of the institutions with whom we work have changed. Many countries where we worked, we've seen the nations become independent, and we've seen new organizations start up and now become fully functioning independent institutions. And so we've done our best to adjust and adapt over time. Our partnership approach has been honed over the years, but its foundation is really Catholic social teaching and the idea that we are living in solidarity with our partners, that our job is to support their work, our job is to respect their autonomy and their ability to lead the development of their own nations. And in the papal encyclical Deus Caritas Est, the Pope reinforced this notion that it is the job of Catholic organizations to be professionally competent, to provide the highest quality of technical care to people, and further reinforced, of course, the notion that that alone is not enough, that we must work with our partner institutions in a spirit of love and care for them. And I think this part of the encyclical really for me, captures why we work both in partnership, sort of the love side and the respect, and the technically competent side, which is really the capacity strengthening approach. Our previous, I understand you were just with Dr. Wu, but our previous president also reinforced this notion back in 2007 in the annual report, when he really underlined the fact that all of our work is done with partners. It is the exception rather to the rule that we work independently, or that we are directly operational at the level of a community. As you travel around the world, if you see CRS operational at the level of the community, it's often because our partners have been incapacitated in some way, perhaps as a result of a natural or man-made disaster, and has rendered them unable to work. But in our view, the working with a local institution is of key importance. They are members of their society, they are there permanently, they are dedicated to the work of the church or of their institution, be it a secular NGO, an NGO of of another faith tradition, or of the local government. And our belief is that we are there to help them do their work effectively. It's really based on our understanding that, and our belief that it is really only through healthy institutions working together with people at the community level that lasting sustainable change can take place. That certainly individuals and families in society have an enormous role in creating the conditions under the just and equitable conditions under which they can live and work. But it is our further belief that local civil society and government and the private sector also play a key role in the development of a nation. And so we build capacity so that those institutions can support the work of families and community. And to go back to Deus Caritas, this is probably one of my favorite quotes ever, that helping partner organizations respond to poverty and justice is a grace. And I think if you speak to any CRS staff member here in this building or overseas, that will be borne out, that we as an institution, and certainly we as individuals, gain much more than we give through this process of partnering. So, you know, we're going through all these terms and saying partner and partnership, so I just wanted to update you a bit on these are obviously commonly understood words, and as you go through the nonprofit international nonprofit world, you'll see that we all use these words slightly differently. So I wanted to share with you CRS's definitions. And for us, we oftentimes use the word partner, and sometimes it's contextual. It'll depend on how we're talking. We may be talking about an individual, or we may be talking about the institution. The default institution is normally the local caritas in a country, either the national level caritas or a diocesan level caritas. It might be the Catholic Health Commission, the Catholic Peace and Justice Commission. But as I said, it can also be a secular nonprofit, a nonprofit of another faith tradition, or the government. But it is an organization with whom we are working on a project to address poverty or injustice, or with whom we are standing in solidarity as they do advocacy work in their own nation, or as we're trying to change U.S. policy here. Our partnership approach is really based, as I said, in Catholic social teaching. The idea of subsidiarity is the driving force, but it's based on mutual commitments, on the idea that even with a partner of a different faith tradition or a secular NGO, we have a values-based discussion. Why are we working together? Who are we? Who are you? What is our view of social change? What is our view of how we combat injustice? How do we address issues of poverty, so that we can come together, we can share our ideas, our resources, our expertise to make a difference in the world. So we develop partnership principles that are based on Catholic social teaching, that idea that we develop this shared vision and we live within it. Subsidiarity, my very funny joke, so I expect you all to laugh, is that subsidiarity is easy to say but not easy to do. And in fact, it's not even easy to say. So thank you for laughing. Subsidiarity really is the hardest one for us to live up to. This is a standard which is extremely challenging. CRS is oftentimes the grant holder or the resource holder. We're oftentimes charged by the donor to achieve certain programmatic outcomes, as well as to have a high level of financial compliance and responsibility. Yet our partnership approach demands on us, I should say, that the work take place at the partner level. They manage the resources, they manage project implementation, so that the rub of subsidiarity is to say they really are in charge of this project, yet we oftentimes have the fiduciary and programmatic responsibility due to our stance as the grant holder. So as you travel around the world and talk to CRS staff, this is probably the biggest challenge we face in working in partnership. We try very hard to set up our systems and structures, so we're respecting our partners. We're treating them as autonomous institutions, capable of making their own decisions. To the extent we are able, we try and live in a spirit of mutual transparency. There are gross power imbalances often between us and our partners. We're what it is now, $700 billion or million, thankfully $1 million institution with thousands of staff in hundreds of countries around the world, and our partners are normally $500,000 or less institutions struggling to meet payroll and buy vehicles. So some of this transparency is a difficult thing to achieve. Some of the balance and equity is difficult to achieve. But I think what I've appreciated most in my time here at CRS is that we make the struggle. These partnership principles are not rhetoric. They're something that people try and live. They try very hard to live up to, despite the many challenges and the very high standard that our partnership principles lend for us. As I mentioned in the beginning, we oftentimes say that partnership and capacity strengthening are two sides of the same coin. That because of a myriad of historical factors, colonialism, neocolonialism, post-colonialism, economic domination, the HIV pandemic, there are many reasons why our partner institutions are not yet strong enough to completely take these grants in on their own or to completely manage their own affairs. And that we see our job is helping individual civil society institutions as well as civil society as a whole become the strongest, most sustainable institutions they can, better able to serve the poor. And so our work is to help them do it through 3 primary approaches. The first is really focusing at the individual or team level in an organization to say, how can we build their knowledge, skills, and attitudes so that they are best able to do their work? How can they be the most technically competent, whether they are working in a water supply project or they're the financial managers within an institution? But we recognize that it's not enough to really look at individual skills, that that individual goes back to work in an institution. And if that institution is not properly managed, if it doesn't have the systems and structures it needs, then that person cannot exercise their skills. A good example would be taking an accountant out, helping her learn new accounting skills, giving her new accounting software, and then going back and she doesn't have the right computer. There's no system of the flow of financial information in the organization, so she's unable to use her skills. So we try and address both the organizational and the individual skills, and we do that using the Catholic approach of accompaniment, that idea that it's not a one-time intervention, but we are there with our partners, walking with them, working with them, calling them, helping them inculcate those new skills and sustain those organizational changes. I have 3 quick examples. The first was AIDS relief in South Africa. This was a large award from the Centers for Disease Control in Atlanta. It was the first antiretroviral therapy funded by the CDC that ever successfully transitioned to a local partner. It's a multi-million-dollar award in a highly complex technical area. We worked very closely with the Catholic Bishops' Council and a few NGOs in the country to help them improve their ART technical care, as well as look at the institutional strengthening they need at the clinical level as well as the headquarters level. And they are now successfully receiving money from CDC directly. They've formed new relationships with the government and are continuing without any drop in care and treatment to people living with HIV. Another example at a smaller scale is in Lebanon, where we worked with 7 Lebanese NGOs who are working in a democracy and governance program, helping these NGOs, Lebanese NGOs, were helping citizens to become more engaged in Lebanese politics, to transcend the political and religious divides that beset the country. And we help them assess their institutions, train staff, and strengthen institutional systems. And we have now received, I think this is the 3rd extension we've had to replicate this process with other partners. We have a project in the Dominican Republic working with a consortium of Dominican organizations, church and non-church, who were working to help children who were living on the street, children who were the victims of sex trafficking, who'd been abandoned because of poverty or HIV in their families. We help them as individual institutions, as well as work as a consortium to strengthen their abilities. And at the end of that funding, at the end of the USAID project that provided the initial funding, UNICEF picked up the project. We have a new project we're starting this year called the Strength and Solidarity Project. This is funded by the Gerald and Henrietta Roundhorse Foundation, GHR Foundation, to help CRS look internally at continuing to strengthen its capacity as a capacity strengthening and partnership institution. So we'll be looking at staff training, we'll be looking at developing more tools and curricula and lessons learned. And I think this is an area where we could potentially be calling upon all of you, and to really facilitate more and more the internal learning we have about what works and what doesn't in working with our partners. The CD I gave you is a copy of the Institutional Strengthening Guide. This was a document that was finalized last year. It's about a 1,000-page guide intended for use by our partners to help them do a self-evaluation of their institutional capacity. And then it has chapters that help them with things like human resource management, financial management, governance, strategic planning. It's available French, Spanish, and English, and soon to be in Arabic and Portuguese as well. The final thing I'll say is that we do have at crsprogramquality.org a library of all of our materials that we use to strengthen our partners' technical capacity, their managerial capacity, and it has several case studies that you might be interested in both our partnership and our capacity strengthening approach.